Why medications will be needed eventually if you have type 2 diabetes. Most people, when they first get type 2 diabetes, hope that they can avoid medications. And yes, lifestyle changes are important, and you should begin immediately. And the longer you can proceed without medications, the better off you are. And the reason you're better off is because it indicates that you're controlling and managing your type 2 diabetes without medications. However, the medications these days are far superior to the medications that existed way back when I first had type 2 diabetes. I'm 76 years old now, and I've had type 2 diabetes for almost 40 years. When I first had type 2 diabetes, we didn't know what we know now. We didn't know how to deal with it. The medications weren't as good. The advice that we would get about how to manage type 2 diabetes with diet and exercise, etc., wasn't as good, and they weren't as emphasized as much. So I want to encourage everyone to emphasize their lifestyle changes with diet, exercise, sleep, and stress, and everything else that's required. And we go over this in detail in our programs. The Type 2 Pivot Method program is our prevailing program right now, and it's a program that I think can help you substantially. It's a 5-week program with different videos and worksheets every week. And I encourage you to take it if you want to maintain control and management of your type 2 diabetes over a long period of time. One of the things about type 2 diabetes that causes you to have type 2 diabetes is insulin resistance. Insulin resistance is basically the ability of your body to manage the insulin that it produces. Insulin is produced by the beta cells. The beta cells, the more you have high blood sugar, the less effective the beta cells are. Therefore, the longer you are having a high blood sugar, generally over 7.0, the less effective your beta cells are. So it's important that once you do get to manage your type 2 diabetes, that you do everything you can to manage your type 2 diabetes with great effort and with lifestyle changes, which we'll go over to in much detail, about how to exercise, what to eat. And one of the things that I emphasize about eating is that we don't change our diet radically. It's too transformational and too difficult to make radical changes, to do something that you're not used to. And it's too shocking to the system to do something you're not to. Most diets will be effective with type 2 diabetes if you just alter them and improve them and eat less. And I'll go over each of your diets, and we'll go over what changes you can make gradually so that you can improve your type 2 diabetes. Now, sometimes people will take medications for a short period of time just so they get their A1C under 7.0 based on a doctor's advice. And then they will try and get off medication. And as long as you can keep your type 2 diabetes blood sugars under good management, you can stay off your type 2, you can stay off your medications. Most people will eventually need to take medications. That's why endocrinologists and physicians call it remission and not reversal. Reversal is this magic word where people think that they've reversed their diabetes. And people want to believe they can reverse their diabetes. And there are some people who can. I like to use the example of Tom Brady and Oprah Winfrey. Oprah Winfrey is someone who goes up and down with her weight loss. Right now, I believe she takes Ozempic, so she's not going up and down as much. Tom Brady, on the other hand, was a football player who had an extremely disciplined diet and ate healthy and exercised properly and did everything almost perfectly. Unlike most of us will be more like Oprah than we will be like Tom Brady. And that's why most of us will end up needing some medication at some point in our lives. So a couple of things to remember are, remember, it's taking care of your, I'm sorry, I was just checking my computer. Making sure that you take care of your A1C level, try and keep it as low as possible, under 7. And then eventually you'll be able to manage your type 2 diabetes with exercise, diet, minimize stress, and better sleep. And we go over in detail how to do these things. And there are other things that we do, like journaling. We become conscious and aware of how our diabetes is doing and making certain efforts subconsciously and consciously to manage our type 2 diabetes. So I want to encourage you to do all those things. So some of the medications that we have these days are fantastic. Jardiance and Farxiga are 2 SGLT2s. They help you lower your blood sugar, they help with kidney disease, and they help with heart disease. GLP-1s like Ozempic help with heart disease, and they help with kidney disease also. When I first started taking medications, they didn't have these drugs, and we run the risk of hypoglycemia, which is low blood sugar. You really rarely run the risk of that anymore. So the medications that you have these days are much more effective than medications that we used to have. So if you do need medications, feel blessed that there are medications out there that are effective. I'm blessed that I take medications now because I manage my type 2 diabetes in a very effective way. I'm very healthy. I have control of my kidney issues. I have control of my heart disease. I don't really have it anymore. And I have control of my blood sugar. So overall, my health is great. My diet is great. My exercise is great. I have a particular diet that I follow, but I'm not suggesting that everybody follow the diet that I follow. Everyone should go with the diet that they're most comfortable with and that they're used to. As I've said, radical changes aren't such a great idea. The priority, and remember that the priority as far as type 2 diabetes goes is managing your health and maintaining management and control of your type 2 diabetes, not managing control of it without medication. If you do it without medication, that's fine. If you do it with medication, that's fine too. It's great too, but either way, you are going to have lifestyle changes along with your medications. You can't have, it's unlikely and it's not effective for you to just substitute medications for lifestyle changes. They need to go hand in hand together. It's so important. Those lifestyle changes need to continue. Your diet needs to maintain to be one that's healthy. Your exercise routine needs to be one that's healthy, that works for you. And it may be lighter or heavier, depending on your situation. And your sleep patterns need to be developed in a way that's more effective for you. So I want to encourage you to do all these things. And I want you to subscribe to my type 2 video right below. And you'll get all the videos that we have here. And if you want to join our type 2 pivot method program, we have a free guide for it in its video that you can get the bio below, or you can actually sign up for it right here also. Thank you and have a great day. Bye.